Bismillahirrahmanirrahim. Today we are going to start the osteology, that is the study of the bones. Out of 206 total bones in man, the upper limbs contain 64 bones. So we are going to start. The long bones in the upper limb are clavicle, scapula, humerus, radius and ulna. The clavicle is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits the weight of the upper limb to the sternum. So the clavicle is also called as the collarbone. It lies horizontally in our body. It is subcutaneous bone, so we can palpate the bone along its entire length. So it is the first bone that ossify in our body, and it has the membranous calcification. That means it calcifies in membrane. It doesn't have any medullary cavity, and it is located between the sternum and scapula. It is roughly S-shaped and resembles a large old style key. Now next we will determine the side. The side determination is the side to which a clavicle belongs. So we will determine it by the 3 points. First of all, the ends. The lateral end, it is flat, and the medial end, it is quadrangular. It is larger as compared to the lateral end. Second point is the shaft. Shaft is slightly curved in the form of the S. In its medial 2/3, it is divided into two parts, the medial 2/3 part and the lateral 1/3 part. The medial 2/3 part is convex forward, and the lateral 1/3 part is concave forward. So it is convex forward in medial and concave forward in its lateral part. The third point is inferior surface. In the inferior surface of the clavicle, there is a longitudinal groove in the middle. So this is how we will determine the side of the clavicle. The ends, lateral is flat, medial is quadrangular and large. The shaft has convexity in the medial 2/3 and concavity forward in the lateral 1/3, and the inferior surface has groove in its middle part. So this bone belongs to the right side.